morning, everybody. My name is Travis Jennings. So I work for the local fire department here, work for the city of Winston-Salem. I've been in EMT for close to 12 years now. I've worked on used to work on boxes. I worked on ambulances for probably going on 6 or 7 years. Starting out in Iredell County, I've worked in Davie County, I've worked in Forsyth County. So I've worked in multiple counties. I've done everything from long transports to 5-minute transports. So EMT is something how I got started and what I love to do. I want you guys to focus on becoming good EMTs, especially if you're going to the fire service. Being a good EMT, 80% of your calls are still going to be running EMS calls, so you need to be good at what you're doing. So today we're going to start talking about advanced airways and airway adjuncts. Does anybody know what these could be used for? Okay, so airway adjuncts, you have two different kinds that we use. Two different kinds that you're going to learn. You're going to have an OPA, which is this right here. This goes, you measure this from taking, well, let me go through this, and then you have NPAs. Here are NPAs. So what do you think an NPA and OPA stand for? Right, so you got NPA, which is nasal pharyngeal airway, and then OPA, which is oral pharyngeal airway. So with these two things, what you're doing is you're securing someone's airway, so that way you can make sure they can, if you're ventilating for them, you can make sure you're getting proper ventilation in. You hold with this, you're holding the tongue forward to keep that airway open, and then you're going straight into the nasal cavity and going down straight down into their airway with the NPA. So the big thing here is when you use an NPA, you got to make sure they do not have any kind of facial trauma, because what you don't want to do is take this, if there's any facial trauma up here or anything's broken inside their skulls, this can actually go up into their brain and cause bad day for everybody. So you want to make sure you're not watching for this. When it comes to OPAs, you need to make sure they don't have a gag reflex, because if they have a gag reflex, they will not take this. So most of the time, if they're, let's say you run an OD and they're still semi-conscious or whatever, but you're ventilating, this isn't going to work. They're probably going to gag on you. But you can definitely put an NPA in, and as long as they leave it in, it'll take it. So those are adjuncts. Let's go over how to do those right quick, and then we'll move into more of the advanced airways, the BIADs. So with the OPAs, so if you can take an OPA, you got your patient's head here. So you're gonna measure from the corner of the ear, from the bottom of the ear to the mouth, right? So you take this and just measure, and you want to make it the same distance, okay? So I go 90 degrees. So I'll do, from other classes, we have head tilt chin lifts to open the airway, and you have jaw thrusts to open the airway, right? So for this one, we're just gonna do a head tilt chin lift. I got our airway open. So now I can take my OPA in, put it in the side here, and as it's going in, I can rotate it, and we're good. So now what that does is that hooks the tongue here. Let's see if I've known, I can show you here. So this will hook. You come in at the side, right here, go in and then twist. As you can see, it holds the tongue and the epiglottis up to keep it from closing. So that way that'll help secure that airway. All right, everybody understand how that works? So then after that, you can take your bag. You can take your bag. Now your airway secured, and ventilate your patient. See? Cool. All right. So now that we got that done, everybody understand an OPA and how an OPA works? Yeah? Cool. So when let's say somebody wakes up, right? They start gagging, this needs to come out. You literally just take it and just pull it out, right? It's got a curve. So when you come out, you just pull it out and pull it. So I'm gonna show you guys how to do all this, and then y'all are gonna follow along with me on y'all's mannequins back there, and we're gonna do it together. So, all right, MPA, okay? The bevel goes right here on the inside of the nose, right? That goes with a curve of it. So you can lube it up a little bit if it's dry. Just put a little lube in there, put a little lube on there. So you're gonna take it, same thing, right on the bevel on the inside, and it's just gonna fall down into place. Push it all the way in. And then, just like with an OPA, you breathe for them. See? Sweet. So, that's an OPA and an MPA. You can do 2 MPAs if you need to. There's nothing wrong with that. If you need to use them, that's perfectly fine. If you need to pull it out, you literally just pull it out. It's just a little rubber thing, super flexible, so you can just pull it and it'll be fine coming out. All right, so any questions about an OPA or an MPA? No? Sweet. All right, so now we're gonna go to the 2 kinds of BIEDs we use here at the EMT level. You have iGels, you have Kings. So these are the 2 different options you're gonna see around here locally. If you work in the same county as me, you're gonna run iGels. We do not run Kings anymore, but we do have neighboring counties that do run Kings. So we need to be familiar with both and be proficient in both, so that way no matter what one we're using, we're able to do it. All right, so up here on the board, as you can see, I wrote down your sizes that you're gonna probably use. So as far as iGels are concerned, because that's what we use mostly here, you have a 1, which is for neonates, about 2 to 5 kilograms. So the math on that is a kilogram is 2.2 pounds. So you can do the math, so it's 4.4 to 11 pounds. We'll do that. And then you have a size 2 for infants, 5 to 12 kilograms, which is 11 pounds to 28 pounds. And then 2.5 is a small peds, so you're at 22 to 55 pounds. Small adult, which is a number 3, is 66 to 130 pounds. Number 4, which is going to be a medium adult, 110 to 198 pounds. And then a 5 is a large adult, they're basically 200 pounds and up. It's 198 pounds, but 200 pounds and up, a 5 will work. So iGels are based on weight. Kings are based on height. So you just need to make sure you judge the different, and I wrote down your heights up here too. So you got a 3, which is a yellow color. That's gonna be a 4 to 5 foot tall person. And then a 4, which is red, is gonna be a 5 to 6 foot. And then a purple, which is your number 5, that's gonna be a 6 foot tall, 6 foot and over. So just kind of do your best guess on, because you're not gonna have a tape measure, so do your best guess on what you have when you're looking at your patients, depending on what you have, what you need. So this is how it comes back. This is how King comes backed up. It's got your holder, it's got your King, it's got your syringe, your lube in here. It's got everything you need to do it. As far as your iGels are concerned, they come like this. They have your iGel. It comes with a holder, like you see here. A little holder for your iGel to sit in. Okay. It comes with your strap right here, and then your lube right here. You can use these more secure tube holders if you have them. I like them, especially if you run iGels that don't have the tabs, which I'll show you one with the tab. Here you go. So we have one with the tab here and one without the tab. So if you don't have these right here will not work because you have nothing to connect it to. So you'll have to use the tube holder like this, which is something you'll get with your Kings, and it's pretty easy. You just slide it in like that, and then you'll tighten it down and lock it into place. We'll get into all that here in a second though. So those are your Kings and those are your iGels. We're using these when if you get a CPR, these are something that you're going to go into. You can start with an adjunct if you need to for a CPR, especially if you're by yourself. This will work just fine. But once you have some help, and if you have the skills and the knowledge, which you will once you pass this class, to do a BIAD, this is what you want to go with. You're going to get more direct air into the lungs, and I'll show you in this mannequin here the big difference. Y'all keep hearing me say BIAD. So BIAD is a blind insertion airway device. So as an EMT, we are not, in scope to be able to use any kind of blades or anything to get down in to see exactly where we're going. So we're shooting blind per se to put these in. But I like Kings better. I like iGels better. I'm sorry. I grew up on Kings. And they work very well. I enjoyed using them for the years I did, but Kings work to me just a little bit better, and they're a little bit more operator friendly because you can take it. You see, it's just one piece, right? So you would take it out of its case. You would get your little bit of lube here, right? There's a little divot here in its little holster. So you take the lube, pour a little bit of lube in that divot. Take your iGel, rub the back and the sides, right? Don't rub the actual part that's going to connect. Just run the back and the sides with lube. And then if you're not ready to put it on, you can put it back in holster and just kind of set it on to the side for now. But let's say you are ready to put it on. You got your patient. iGels are nice because you take it, put it in their mouth, right? I'm going to show it on here first. So I use the scissor technique because it's just easier for me. But you can do a head tilt chin lift, open that up. I do a scissor technique to open up the mouth a little bit, slide it in beside my thumb, get it in there, and then once it's in, I just push it in, and you'll feel some resistance, and then you'll feel it pop, and it'll pop into place, okay? So once it's popped into place, you'll feel it pass over. Once it's popped down, put your ears on, take your bag. I do this before I secure it in case I have to move it. And then you would listen to your lung sounds. And once you just do your breaths, make sure you're where you're supposed to be. As long as you got equal chest rise and fall, and you got breath sounds like you're supposed to, and there's nothing in the stomach, you're fine. That's where you want to be. And then you would take your securing device, whether it's the strap or one of these, put it in. Took it out before I showed you. Then you can secure it in place. So I take mine, I slide it in. These are a little bit harder to get in just because of the shape of them. I'm gonna have to go over top if you can. All right. All right, there we go. Now we're in. All right, so we got, there's a little plastic piece here. You want to make sure that goes down the corner of the mouth. You got it around your iGel. Go around the back of their head. Alright, and now we are locked into place. Okay, so now you can put your bag back on and you just breathe. And now you're secured. You don't have to worry about your airway coming out, and you're ready to go. Any questions about that? No? Okay. So we're gonna keep going. And then after I'm gonna have you guys, we're gonna work on these skills together, okay? I just wanna show you everything. If you have any questions, this will be the time that, we can ask about it now, and then we can go with it. So, all right, so iGels, you see those? Let's see how they are. Now, when it comes to Kings, Kings are a little bit more time intensive, but not terrible. We're gonna go with a 3 because I think that's what the mannequin here carries. So you take your 3, get your height base, and you can see on here there's a number, 45 to 60 milliliters. That's how much air it takes to pump up these bulbs. So the first thing you're gonna do is you're gonna pull your pull up to get your syringe that comes with it. Pull up to where you're at. So we're at 45 to 60. So I'm gonna go all the way to 60. You're gonna hook it in. This is before you put it in. You're gonna look at your bulbs. Bulbs, make sure there's no leaks. Make sure they're good. You got a little bulb here. That you're good. All right, so now you can pull your air back out as you know it's good. Untwist. So when you lube these, you take your jelly and you lube the actual bulb itself, not the shafts. So now, same thing. I like to do mine from here. It's just easier for me. I do a head tilt chin lift. Kind of do my my scissors. I go in at a 90-degree angle. Okay, you can go in the top. I don't like it. I like going in 90. Going in at 90. Get it down in, and then you'll rotate it in and push down. Get it inserted. All right. So there's a mark. There's a bite block here. That's where you kind of want the teeth. So once you get that, now you take your syringe and you blow it up to 60 and watch it. You'll see it move. Hold it down so you don't lose any pressure and pull it off. So now you're locked into place, right? And you'll see it kind of pop. So now you do the same thing. You take your bag, put your bag on, listen to your breath sounds, listen to your lung sounds, look for equal chest rise and fall. Make sure you're not in the stomach. So it looks like here I'm a little bit in the stomach. As you can see the stomach moving. So we don't want that, right? Because if you're blowing air into the stomach, what's gonna happen? They're gonna throw up, right? So you can kind of pull it back a little bit, and then reset, and then do it again. Make sure that you are, sorry, I don't want to come off, in the right spot. All right, now we're good. Now we got breath sounds and no stomach sounds. So we're good. So now we would take, while somebody's breathing, right? Because remember this is CPR probably. Now while they're breathing, somebody takes their tube holder, they put it in, lock it into place, just like you would the eye-gel. Boom, and now you're breathing. If this is CPR, you're doing now, and for here, we're doing consistent CPR for 2 minutes, and you're breathing every 5 to 6 seconds, and then you rotate. Any questions about what we saw and how to do it? I'm about to let you guys go about it and get at it, so I just want to make sure you understand what we're doing before we get into it. All right, no questions? Cool. So get your, we got eye-gels up here, we got Kings up here, we got OPAs, MPAs. Get everything you need. Everybody can get one. It doesn't matter what size you get for now, because I just want you to practice the skill. So we're gonna get everybody to get one, and then we're gonna go to the skill together, and then I'm gonna have you break off in groups, and you're gonna do the skills by yourself. Sounds good? Cool. All right, thank you. Come up here and get your stuff.